those concerns as it relates to the spread and the transmission of this virus. We started to see density of transmission in certain parts of the state. Other parts of the state just didn't experience any real transmission. We saw deaths increasing in certain parts of the state. We did not see that in other parts of the state. Many counties, many regions asserted themselves, understandably, making that point that they're different from other parts of the state. And we began the process of what we refer to as attestations. And these were locally directed attestations, attesting to certain criteria, certain responsibilities, certain procedures and plans that would be put into place through a technical engagement with the state of California that would allow certain parts of the state to open a little bit more quickly than other parts of the state if, in partnership with the state of California, they attested to being prepared and being accountable and responsible for the transmission of this disease. You recall at the time we talked about making sure that part of that attestation includes making sure you have adequate testing, making sure you have adequate capacity to begin the process of contact tracing, making sure you have appropriate levels of PPE, personal protective equipment, not just face masks, but gowns and gloves and the like. We also had responsibility within the hospital system to make sure that they could address possible need for a surge, and that include not just hospital space, but also prospects that they have enough ventilators and ICU capacity as well. We also had a framework of focus on homelessness, on issues related to seniors in our skilled nursing facilities and our residential care facilities, as well as people in congregate facilities, locked facilities, county jails, adult correction facilities, and the like. Butte County was the first county to move forward with an attestation, and we started our phased approach to reopen the economy here in the state of California. We talked in terms of 4 phases. We have been clear through the attestation process that we will allow counties to move forward on their own time through 3 phases, not the 4th phase. And I'll remind you that 4th phase is large-scale festivals, outdoor facilities and concerts, rather, facilities like convention facilities and the like, large events, for example, sporting events. That's all in that 4th phase, and no part of the state of California is allowed, even through that attestation process, to move in to that 4th phase. But people are pacing in and through
Thống đốc
phase 2
California
and phase
đang
3.
họp báo nói về
We
vấn đề
had,
những
at
cập nhật
last
của
count, last week, we had
coronavirus
over
ở tiểu bang.
52, and then we went to 54 counties that
Trong
had
cái
gone through this
thời điểm mà các
attestation.
con số
We highlighted one
lây
county
nhiễm đang tăng,
that was interested in moving
thì ông
forward
vừa mới
in
nói
the
tới cái chuyện là
attestation
cái
phase
phase 4,
in
tức là
Imperial
cái giai
County,
đoạn 4 đã
but
mở
was
ra
simply
là tất
unable
cả
to
những cái
attest that the
sự
conditions
kiện
were
lớn
such that
được
they
chấp nhận đó, thì cái giai
can
đoạn 4 đó
mitigate the spread of the
chưa
virus
được
and
chấp
also
nhận ở
protect their
California.
citizens if indeed there was a surge. On Friday, I highlighted Imperial County as an example of a county that not only did not move forward with an additional attestation, but needed, we believe, and continue to believe, needed to move back. That despite the fact that they were not able to attest to go in deeper into this phase 3, they were able to open some parts of their economy. But even so, the spread of the virus in Imperial County was such that we as a state were working with that county to decompress their hospital system. Over a 5-week period, just a 5-week period, we had to move 500 patients out of their hospital system into surrounding county systems, putting a lot of stress and strain on the surrounding systems, but also reinforcing the imperative to address the conditions in Imperial County and address why the spread was continuing at such an extraordinary pace. And when I mean extraordinary pace, we had positivity rates. Remember, positivity rates, number of people tested, percentage of people tested that test positive, positivity rate. We had positivity rates in Imperial County as high as 23%. And that raised red flags. And over the course of many, many weeks, we've been supporting our technical assistance teams have been sent down there, federal, state, regional teams, including just this weekend, where we sent down 3 of our cabinet secretaries to meet with representatives and to only reinforce our support to address the conditions in the county. We encouraged the county on Friday to begin to phase back, to use what we referred to over the course of the last few months as the dimmer switch. We talk about these attestations, but they also have a dimmer component as well. What you attest to is also your capacity to toggle back, to dim the reopening, to move back into a place where we can mitigate the spread. And that's exactly what we are requesting of Imperial County. Their formal County Board of Supervisors will be meeting today and tomorrow in making that determination. If they are unsuccessful in building consensus around going back into a stay-at-home order frame, the state of California will assert itself and make sure that happens. Accordingly, and I highlight Imperial as we did on Friday, just to underscore the unique characteristics and conditions that persist and exist throughout the state of California. But there are also many other parts of the state that we are monitoring. In a moment, I'll get to some slides and show you more specifically the number of counties that we are currently monitoring and what that monitoring looks like. Dr. Galley will come up and talk a little bit more specifically about what the criteria and conditions are to end up on this monitoring list, this watch list, and then work we will do as a state to begin, again, to use that dimmer switch as we are suggesting and ultimately require in Imperial County. By the
Ông
way, that's
đang nói tới
exactly
việc
what we did over the
tiểu
weekend.
bang
On Sunday,
đang kiểm soát
recognizing the
rất là
transmission has increased in areas of the state,
kỹ về cái vấn đề những
not
cái
just in Imperial
quận
County, we moved forward
về cái tỷ lệ
to
lây nhiễm.
require 6
Có quận mà
additional
tỷ lệ lây nhiễm
counties
cao thì
to,
sẽ
for example, toggle back
siết
and
chặt
use
lại
that dimmer
để mở
switch
cửa
by
khi
closing down
về
bars
tránh
in
bùng
order
phát
to
thời
slow the
kỳ
spread of the virus. We also recommended
cách ly ở trong
yesterday,
nhà,
Sunday, that 8
trong đó
other
có quận
counties
Imperial
consider
County.
doing the same. We, as I said, are working very closely and collaborative with Imperial County because we believe they need to move back into that stay-at-home posture. The bottom line is we're doing this because we have seen
Nhắc
an
lần nữa là
increase
cái quận
in the spread of this
Imperial
virus.
County là cái quận mà nó
We've
bị
been very
lây
clear,
nhiễm
this
cao lên.
shouldn't
Bây giờ
surprise
có thể là
anybody
sẽ phải
watching.
trở ngược lại
As
cái
you
thời
reopen
kỳ
the economy, as we move away
ở
and
trong
make
nhà,
meaningful
cách ly trong nhà.
modifications, which we did to our stay-at-home order, you're going to see people mixing that otherwise were not mixing in the past. Many people were not necessarily being as responsible as they otherwise, as we would like them to be as it relates to practicing physical distancing, social distancing, people that weren't wearing their face masks. That's why a week plus ago we required mandatory face coverings, face masks in the state of California to help mitigate the spread. We need to take further steps, and that's exactly what we did
trên màn ảnh chúng ta cũng có thể thấy đó là ghi rằng là có 7 cái quận đã bị đề nghị là phải đóng cửa những cái bar để mà giảm cái sự lây nhiễm. 8 cái quận khác thì đang được đề nghị sẽ phải đóng. Còn cái quận Imperial County thì là phải
to
cách
4th
ly
of
tại nhà.
July weekend. We'll talk more
Vì
about
đã
that
có rất
over
nhiều
the
những
course of
ca
the next
nhiễm
few days
trong
and our
cộng đồng.
concern from the health perspective of people mixing, extended family, and other people coming together and congregating that otherwise are letting their guard down a little bit and mixing. That is also one of the reasons we're seeing an increase in the total number of positive cases in the state. But we start with bars in these counties, and we have 8 counties, as I said, on top of those that we have mandated the closure, that we recommend the closure. Let me tell you the criteria we put forth for the bars. That's 14 days where we have seen these counties on the watch list, and that becomes the criteria. Once over a 2-week period, and you're still on that watch list, and we're still seeing an increase in spread and transmission, that then triggers the kind of decision that we made yesterday. The 8 counties that we're recommending, those are on a watch list, but just 3 to 14 days. None exceed the 14 days on the watch list, but none are less than 3 days. And we're encouraging, working in partnership with the health officials in those counties to consider similar guidance, and to the extent that they choose otherwise after a 14-day period, we'll assess that and we will make the determination, our health team, as to whether or not we will ultimately make that decision for them. So
những cái quận mà được xem là phải để ý là sẽ từ 3 cho tới 14 ngày để ý để mà xem như thế nào. Nếu mà sau 14 ngày đó mà giảm thì chúng ta lại tiếp tục.
And obviously now the actions we've taken as it relates to the bars. But let me now show you why that's the case. Here's the case numbers from Friday. 5,932 new cases on Friday. Saturday, 4,810. And of course, you see the Sunday numbers. This is the latest reporting period, 5,307 cases. That represents over a 7-day period. If I went back and provided you another slide, just to give you a sense, a 7-day snapshot, in the last 7 days, we've seen a 45% increase in the total number of cases that have tested positive in the state of California. There are a couple reasons why that's the case, and this slide is an important slide to underscore that. Again, forgive me, I've repeated this many times, showed this slide on many occasions, but it's an important slide. The first 14-day cohort of positivity rate in the state of California that we recorded showed 40.8% of people that were tested positive. The last 14-day period, we are now at 5.5% positivity rate. But you see on this graph, those of you that are watching, not just listening, on this graph, a significant increase in the blue lines here. The blue lines represent the total number of tests in the state of California, from less than just a few thousand in April to a record number yesterday, just shy of 106,000 tests were conducted.
Trên màn ảnh chúng ta có thể thấy cái đường màu cam đó là cái đường cho thấy là cái lượng ca mà xét nghiệm ra dương tính. Mà những cái vạch màu xanh đó cho thấy là cái số lượng xét nghiệm. Số lượng xét nghiệm nhiều lên nhưng mà cái số lượng lây nhiễm nó giảm đi.
This is why we are monitoring it very, very closely. And let me give you another slide here to see more specifically the concern. Just a couple weeks ago, we were at 4.4% positivity. And you recall, the reason we started to reopen our economy is we saw the positivity rate remain very, very stable. Number of hospitalizations and ICUs for many, many weeks, arguably a few months.
Nhưng mà tính ra qua những cái tuần vừa qua thì cái độ lây nhiễm nó cũng đã cao lên từ 4.4% bây giờ lên đến 5.5%. Trong những ngày mà nó cái độ lây nhiễm nó ổn định đó, chấm mấy đó thì bắt đầu mở cửa trở lại. Giờ đây thì bắt đầu tăng lên chấm mấy thì bắt đầu phải báo động.
Of concern. It's not where some other states that are generating headlines are. They're substantially higher, but we don't like the trend line. And that's why, again, this mandatory mask requirement is in effect. And that's why, unfortunately, we're using this dimmer switch to start to pull back on the stay-at-home order. By the way, that 5.5% masks, forgive me, but it does mask the 7-day trend, which is at 5.9%. So 5.5, you see here in this chart, is the 14-day. Just the last 7 days, we're up to 5.9% positivity. As it relates to hospitalizations, not surprisingly, accordingly, you're seeing hospitalizations increasing in the state over the last 2 weeks.
Trên màn ảnh thì chúng ta thấy cái biểu đồ của cái việc mà những người cần phải vào nhà thương nhập viện đó, nó cũng tăng.
You'll see, though, here in terms of our
tăng
total
trong vòng
capacity as a
từ 3.000
system,
mấy tới 5.000
our
mấy.
capacity absorbed this. And I just want, again, to take a moment. All of
Cái
these
trên màn
months
ảnh là chúng ta thấy
when we did the stay-at-home order, we didn't sit on
cái
our
sức chứa
hands. We
của cái hệ thống
worked aggressively, not only
y
to
tế của
engage
California.
with our county health officials, as I noted the top of
Màu
my
cam đó
remarks,
là
but also
những cái ca nhiễm,
to
còn màu
engage
xanh
them
đó là
with
cái khả năng
purpose and intention. And that is to really assess what our
tiếp
needs
nhận
are
bệnh
in
nhân.
this state to work our way through the first wave of this pandemic. And remember, we're in the first wave, and then to prepare for a second wave, which many experts believe will come later into the fall. That included making sure we had a healthcare delivery system that included alternative care sites, included hospital beds, and plans, protocols, and procedures to significantly increase our capacity within and around the system, not only in terms of physical capacity, but also human capacity. We had this team referred to as the Health Corps. We identified personnel and appropriate protective gear and worked to really build out a robust framework for our planning purposes. In this slide, you'll see reflected our current capacity as it relates to hospital beds in the state, just shy of 75,000 hospital beds in the state of California, 73,867 to be precise. And by the way, that number changes on any given day for a myriad of different reasons. We currently have, you saw from the previous slide, represented 4,776 individuals that are COVID-19 positive cases. So that represents about 7% of the total hospital system capacity. Also referenced on this slide is the total number of admitted patients, just across the spectrum of patients that are in the hospital system, which is currently about 58% of total capacity. So you get a sense here, 30+ thousand or so bed capacity that we have in this state. Just within
Một lần
the
nữa trên
hospital
cái
system
màn ảnh thì chúng ta thấy cái
alone. In addition to
biểu đồ
this,
đó
we
là
have
màu cam đó
protocols, plannings,
là
and
toàn bộ
processes
những cái
that
số lượng
we
người
are able to turn on these
nhập viện
alternative, we
vì
call
tất
FMS
cả mọi lý
sites,
do,
these
cho mọi
federal
bệnh,
medical
tức là
station sites, and these other alternative
42.895.
care sites, which we have talked
Còn cái
about
phần
over
màu
the course
trắng
of
là
the last many months that
4.776
we
đó
have
là cái số
procured
lượng
and
nhập
identified all
viện
up
là
and down the
vì
state, Seton
nguyên nhân
Hospital
là
in
vì
Daly
Covid.
City as one
Cho nên cho
example,
thấy là cái
the Arco Arena,
tổng số
Sleep Train Arena
42.895
up here in Sacramento. All these are
là đã chiếm
examples
khoảng
of
chừng
those
một nửa của cái
alternative
khả năng
care
tiếp nhận
sites that have now capacity and
của
we can turn them on
hệ thống y
in
tế
pretty
của
short
California.
order. ICU admissions, again, we focus on positivity rate. We focus on hospitalizations. We also focus on ICU admissions. You can see, not surprisingly, hospitalizations went up 43%, ICUs tracking with about 37%
Biểu đồ này cho thấy
over the course of the last
cái
few
việc
weeks.
mà
You
nhập
see on
vào
this
những
slide,
cái khu
that represents about 13%
chăm sóc đặc biệt
of
vì
the
bệnh Covid
entire ICU capacity in the state of California. Though currently a lot of ICU beds are being utilized for non-COVID-19 patients. If you just look at the total number of beds available today as a snapshot, we are utilizing about 39% of that capacity of available beds are represented rather in the total number of COVID-19 patient cohort. If I confused you, let me step back and say that again. Total number of ICU positive patients versus the total number of ICU beds in the state is 13% are now COVID positive of our ICU capacities. But of the available ICU beds, roughly 39% have been absorbed because of COVID-19 positive patients. So it gives you a sense of the capacity we have in our system that will allow us to work our way through and manage the increase in the transmission of this virus, including, by the way, the ventilators that are available today, over 11,577 ventilators that are available today for use.
Thì thật ra là mấy bữa nay bắt đầu có những nơi nói tới là kinh tế, cho nên là bắt đầu có cái nơi ca nhiễm nó gia tăng. Thì thật ra nó cũng đang nằm trong cái kế hoạch của toàn quốc hoặc là của các tiểu bang thôi, tức là cần phải mở cửa ở 4 giai đoạn. Nếu mà từng giai đoạn mà tốt thì sẽ sang giai đoạn kế tiếp. Còn nếu mà gia tăng ca nhiễm thì sẽ lùi lại cái giai đoạn trước đó. Đó là một cách mà đã tính toán ngay từ
It
đầu
is a
về cái chuyện mà
dimmer
cần mở
switch.
cửa trở lại.
Diverse cities, diverse counties, different parts of the state experiencing different challenges for different reasons. Let me, well, in a moment, Dr. Gallagher will come up and explain, rather than me, what those different reasons are. You may see increases in certain counties, may be primarily because of spread that exists, for example, in a state prison, other parts of the state in a federal prison, and that increases the total number of cases in a county. Others have more generic community spread, which is just people mixing and not, in every case, wearing face coverings and not practicing the social distancing. Each county, different conditions. So when you look at the numbers, you have to get in under the hood on why those numbers are increasing. And again, that's the approach. There's a more
Chúng ta
sophisticated
thấy trên
approach
màn ảnh là
than we
cái
have
hình
time to
ảnh
express
biểu
or
tượng.
explain here today.
Cái
But
cách mà
the
mở
approach
cửa nó
is a
giống như là
dimmer
cái
switch,
đèn
and that approach
theo
is
cái dạng
different
mà mở lên mở xuống
in
đó.
each
Nếu mà
county. Final
cái chỗ
words
nơi
from
nào
me.
mà
I'll
nhiều
ask Dr. Gallagher
lây
to come
nhiễm
back
thì
up. As I've
sẽ kéo
said on
xuống, còn nếu
multiple
mà
occasions, we monitor daily,
chỗ nào
county
mà
by
được
county, the
tiếp thì mà
conditions
kéo
on
lên.
this
Đó
dashboard.
là
And
một
we're
cái
making
sự
that
mà uyển
dashboard
chuyển trong
public.
cái
We
vấn đề
announced
mà đối
last
phó
week
với lại
some of
các
the
ca nhiễm.
efforts to truly be as transparent as we possibly can be in terms of our modeling approaches and in terms of providing you real-time look at where your county, where your community may be. So we're actively monitoring all 58 counties in the state of California, but we're now targeting our monitoring in 19 counties. By the way, when we went into the weekend, on Sunday, we had 15 counties we were monitoring. We added 4 more counties today. We added Solano County, we added Merced County, we added Orange County, and we added Glenn County to the targeted engagement list. So now we're 19
Hiện nay có 19
counties.
quận ở
Dr.
trong
Gallagher will attest.
toàn tiểu bang
Now
đang
that
được
represents
kiểm
about
soát,
72% of the
gọi là để
population
ý một cách chặt
in the
chẽ.
state of
Trong
California.
đó ông vừa mới
72%
nhắc là cũng
the
có quận
population
Cam luôn.
represented
Cam
in
là nơi
19
ngay tại
counties that have
cộng đồng
targeted
người Việt
engagement with our
ở ngay
state
quận Cam rất nhiều.
health officials. And as you see from the slide reference here, again, 7 of those counties, we are now adopting this dimmer in terms of their reopening. But with that, let me now bring up Dr. Gallagher to explain this slide in terms of what local conditions mean and how they drive our response. And I'll come back up.
Ông sẽ mời một vị bác sĩ của tiểu bang lên nói chuyện tiếp.
Thank you, Governor. Good afternoon. I wanted to remind you a bit about how we are looking at our support and work with various counties around ensuring that their epidemiology, that is really just to say the data that we're watching closely around cases and availability of things like hospitalizations and limited hospital capacity in order to ensure that counties have the level of support they need to manage spread, and then to think about, as the governor discussed, the ability to further dim or go back with certain sectors. So just to remind you, we're watching closely elevated disease transmission. So what does that mean? That we want no more than 25 cases per 100,000 people in a county reported as a case over a 14-day period. We're also looking at a test positivity rate less than 8% over the 14-day period. So as the governor is discussing the overall climb across the state, from the mid 4% to the mid 5% over 14 days of test positivity, we're looking at that county by county as well. We also want to know that we have increasing hospitalization or have enough space in our hospitals. So watching very closely each county's census, that is the number of people with COVID positive diagnoses in hospital beds. So ensuring that that 3-day overall average of the number of COVID positive hospitalized patients is no more than 10%, signifying when it crosses that 10% threshold that day over day, many, many more COVID positive patients are needing hospitalizations. And then connected to that is ultimately our ability to care for people in the hospitals. When we see less than 20% of ICU beds are available in a county, or that less than 25% of the total ventilators a county has are available, we get concerned. And that's what helps us look at
Ông nói
counties
rằng là khi
and
nào mà
basically
dẫn
places
tới
them
thực
on the
trạng
county
bùng phát thì
monitoring list so we can begin that targeted engagement.
còn lại khoảng chừng 20% cái khả
As the
năng tiếp
governor
nhận
said,
bệnh
in
nhân, hoặc là
California, a state this
còn lại chỉ
size with this many
25%
people,
cái
we're really experiencing
số lượng máy
COVID-19
thở
in
thì lúc đó
quite
hay
different
là
ways
cần
across
quan
the
tâm.
state. Sort of looking at 3 different counties, starting in the north with Sacramento County, where we are here. With our close work with Sacramento County leaders, they have identified that family gatherings, getting together with family members, maybe outside, probably inside, not following some of the guidance around face coverings, staying socially distanced, likely led to outbreaks within families that led to the rise in cases and then the rise in hospitalizations that we're seeing in Sacramento County. An over 40% rise in hospitalizations over 3 days in Sacramento County alone. Moving further south to San Bernardino County.
Ở trên màn ảnh thì chúng ta thấy
This one due to local jail outbreaks,
những cái nơi khác
skilled
nhau ở
nursing facility
California
outbreaks, as
có
well as
có
community
những cái nguyên nhân
spread.
khác nhau
This
khiến
sort
cho
of
cái
hybrid scenario in
COVID
San Bernardino has had that county
tính nó tăng.
experience
Ví dụ như ở
quite a significant
Sacramento
rise in
County thì
cases. And then
cái
looking at
phần phía
Imperial
Bắc
County
California
again,
thì là
we sent
gia tăng là tại vì do
entire
các
team
cái
of
buổi
senior
họp của gia
leaders
đình.
down again this
Còn ở
weekend
San
to
Bernardino
augment that
County đó là
ongoing
phần
work
giữa
that the
của
governor
California
highlighted last
thì
Friday
do cái vấn
of
đề
the engagement with Imperial
liên quan
County,
tới
and really looking closely
ở
not
trong
just
các
at the
trại tù.
the border with
Imperial
Mexico,
County
but also the border with
thì
Arizona,
nó lại liên quan tới những
understanding
cái
how
vấn đề di
factories
chuyển
and
ở
farms
trong
play into disease transmission, and then
trong
how
vùng.
that spills over into community transmission, similar to what we see in Sacramento County within households and at family gatherings. So again, emphasizing that each county, each part of the state needs a different solution to getting control of COVID-19 spread. And our team at the state, working closely with officials at the county level, are crafting those solutions and determining what can be done in advance to recommending and even requiring moving back. To continue on that theme, we look at this in 3 progressive areas in terms of enforcement and effective community action. We're looking to help support counties in stabilizing their data as the first category. This is emphasizing education and public awareness, ensuring that our messaging is reaching those populations that are experiencing the highest rates, those most vulnerable, and then looking to pause any further new sector opening. Once a county moves to the next level of concern, we start doing things like you saw over the weekend, right? Closing a specific sector, looking at what sort of additional technical assistance and support we can provide a county, looking at those sectors that close, understanding what they might do differently when they reopen again, and then establishing strike teams at the state, not only in Health and Human
Ở trên
Services
bàn
through the Department of
màn ảnh thì
Public
chúng ta
Health,
thấy
but
có
inviting
3
a
cái độ
wide array of
quan tâm.
agencies and
Nhất là
departments
nó an
to
toàn
support
thì
those counties in improving those
bình thường
conditions
chỉ
so we can avoid
giáo dục
moving into
cho
what
cái
we think
công
is
cộng
the
thôi, nhưng mà
alarming
cái phần
rate
bắt
of
đầu
spread, where we,
đáng quan
of
tâm
course,
thì phải
continue
đóng
all
cửa
of the
một
things
số
we
những
were
cái
doing
nơi, vân vân.
initially, but
Còn
then we
đến
look
mức độ
very
cuối là mức độ
closely
báo
with
động
elected
thì
officials, health officers, at considering requiring a return to stay-at-home order. And the only
nó có
county
những
so
cái
far, as a result
những
of
cách
the really
cách
high
xử
rates of test
cho
positivity,
các cái tình
the
trạng khác
number
nhau
of
thì có cái
patients
cách
and people we were moving
phản ứng
out
khác
of the
nhau.
local hospital system into the regional and statewide hospital system
Nhất
out
là
of
trong cái giai đoạn
Imperial.
mà
We're
thứ
asking
3 là giai
them
đoạn mà
to return to the
báo động đó,
stay-at-home
thì
order
sẽ
today.
bắt buộc phải
So with that, I'm going to
quay
turn
trở
it
lại
back
cái
over to the
lệnh
governor. Thank you.
cách ly tại gia.
Thank you, Dr. Galley. So bottom line, and we've reinforced this on many, many occasions, there's different transmission
Trên màn ảnh thì
dynamics
chúng ta
that
thấy
persist
có cái
and
bảng nhắc
exist in
nhở
every
là
part of the state. What Dr. Galley
để có thể
is
giảm
referring to as
làm
relates
chậm
to
lại
that
cái vấn đề mà lây
differentiation
nhiễm
is also
COVID-19 thì
recognition
có 3 cái điều căn
that
bản
the critical
là
need to mitigate
đeo khẩu
this
trang.
transmission also requires
Cái thứ hai là
enforcement.
đứng cách xa với nhau.
And
Cái
it
thứ
is
ba là rửa tay.
incumbent upon all of us to do what we can to lead by example as individuals by wearing face coverings when we can't practice physical distancing, social distancing, but also as business leaders to protect not only your workers, but to protect your customers. We will be stepping up our enforcement in the state of California. There's many mechanisms to which you can enforce. At a state level, there's some tools. At the local level, there are even more tools. Again, locally, that enforcement is driven by decisions, the county health officers, by elected representatives. At the state level, we made comments last week, and I'll reinforce them here today, in relationship to the budget that I'll be signing later this afternoon, that stipulates $2.5 billion of COVID-19 related and realignment related dollars to the counties that will stipulate certification as it relates to capacity to enforce these health orders. It is incumbent upon all of us in the state of California to take seriously these rules and these regulations and to enforce them. And I want to just encourage our partners, and they have been incredible partners up and down the state of California, to do justice and to help us mitigate the spread and the transmission of COVID-19 by enforcing these rules and regulations, not punitively. Again, it's not a ready, fire, aim approach. It's a ready, aim, fire, meaning we want to work with people and be responsive and responsible to help support their needs, particularly small businesses. I deeply understand that, intimately understand that as a former small business person. Help educate on the rules and procedures, but moreover, remind people. We put out over 30 sectoral guidelines in the state of California that lay out how to safely reopen. We've been so fixated, and I cannot impress upon folks this point more. We've been so fixated on
Nãy giờ thì tôi cũng quan sát ở bên số người khác, thấy cũng có những cái câu hỏi đặt ra là trong khi mà những cái ca nhiễm bắt đầu lên cao California thì sẽ đặt ra rất là nhiều những cái quy định như chúng ta thấy đó, nhất là trong cái thời đoạn báo động thì sẽ phải đóng cửa các cơ sở thương mại rồi buộc cho mọi người ở nhà vân vân đó. Nhưng mà có nhiều người đặt cái vấn đề là tại sao nhắc gì vấn đề các cuộc biểu tình, cấm các cuộc biểu tình không được đi ra để mà gọi là xa cả với nhau, như vậy thì càng lây nhiễm, không được nhắc tới hoặc là cấm. Thì chắc là mọi người cũng hiểu được câu trả lời là cấm thì cấm, những cái cơ sở thương mại thì còn được, tại vì họ còn sợ phạt, chứ còn những người biểu tình thì họ đeo khẩu trang, họ ra họ làm ào ào rồi họ đi, thành ra cái đó không thể cấm được, cho nên là không nhắc được tới đây. Nhưng mà rõ ràng đó là cũng là một cái nguồn lây nhiễm cao. Ta thấy các nhà chính trị gia thì thường là không thể nhắc tới những vấn đề đó.
I don't want to do this in a punitive mindset, but we have to keep people safe, because what we don't want to see happen is a few bad apples that are flaunting and exploiting the situation and making the rest of the industry, making some of their competitors look bad. And so we've got to, I think, do more to be more responsible individually and within sectors of our economy. And so we've got the tools, capacity to do more effective community enforcement. And again, we're going to be doing just that. Let me just briefly mention a few other things that are top of mind. It certainly were deep focus over the last many months, but primarily in the last few weeks. There's been an increase in the number of cases in certain prisons in our prison system in the state of California. You may recall a few months ago I brought up some concerns around Lancaster Prison, Chino Prison, some other prisons in the state of California where we saw an early outbreak of COVID-19. In many of those prisons, we were able to mitigate the spread, and we've seen a diminution in terms of total number of inmates.
Ông đang nói tới tình trạng nhiều cái nhà tù là bị ca nhiễm ca lây rất là tăng rất là nhiều. Một số nhà tù thì có thể tí bớt lợi, nhưng mà một số nhà tù thì nó rất nhiều. Tại vì chúng ta biết là tình trạng ở trong tù thì cái chuyện mà khả năng gọi là cách ly với nhau rất là khó trong cái số lượng tù nhân nó đông như vậy.
In San Quentin, we currently have 1,011 individual inmates that have tested positive. And by the way, those are numbers that came in this morning. People are being tested in real time. Test results are coming back in real time. So that's a dynamic number. So entire system, about 2,600 people. Remember, you've got about 113,000 prisoners, 113,000 inmates, rather, in our correctional system. We currently have about 600 that have tested positive for COVID-19, but 1,011 have tested positive just in San Quentin. And so that is our deep area of focus and concern right now. A number of months ago, did a number of things that got a little attention. Perhaps you may not be so familiar with it, to quote-unquote decompress the system, meaning to provide space and provide more flexibility within our correctional facilities to allow people to more safely move about and to mitigate the spread of this virus. From the intake center that we capped for a period of time to changing the way we were doing transfers between the prisons. Obvious concern about transferring someone that may be tested positive, and that's exactly what looks like occurred at San Quentin. I'll get to that in a moment. But we did that in addition to looking at people with sentences that were almost concluded. And we looked at those sentences within 180 or so days, and we said, look, you're going to be released in 180 days. Those of you that have real plans, those of you that have a place to go, those of you that can connect with our system, probation parole system, and have actual plans in place, we're going to move you forward a little bit sooner. And we did that for a cohort, what we refer to as non-non-nons and non-sex offenders, meaning it's a criteria to screen out those that are the highest risk if they are released. But again, these were sentences that were already being concluded. Roughly 3,500 people went out of that system in a very orderly way along those lines a number of months ago. We are working with many advocates in the courts and others. We have identified an additional cohort of over 3,500 additional prisoners working through a similar process. And accordingly, and not surprisingly, looking at the medical conditions of many of our prisoners, those that are most medically vulnerable. And I said this a few days ago.
Ông đang nói tới cái tình trạng ở trong tù đó thì
that San Quentin has about
một
42%
trong những
of
cách
its
để mà
prison
đối phó
population
một số cách
that
để
is
đối
deemed
phó là
medically vulnerable.
tìm cách
For many
là
different reasons,
giảm
that's
bớt
the
được
case.
cái
So
khoảng
it's a
cách
a
của các
large
tù nhân,
percentage of the total number
cấp
of
thêm
prisoners in
khoảng
San
cách
Quentin
rồi
that are in
cái vấn
this
đề mà khi mà di chuyển các tù nhân từ nơi này qua nơi khác
area of
cũng
concern. That
có những
said,
cách
we are working
và
to
cái quan trọng là
work through the medical
có một
screening
số tù nhân
and
sẽ
move
được
people as quickly
ra
as we
sớm,
can, but as
đằng nào
safely and more
đã
importantly, responsibly as we can. Let
đã
me
nhận
be
lãnh
specific
án
about
và
that.
đã thi hành án
We
một
have
thời gian rồi, bây giờ cho
110
ra sớm để
individuals
mà
that we've identified
giảm bớt
for
cái
that
gánh nặng ở trong
protocol and early
các
release within 180 days,
tốt
non-nons,
là tù nhân
non-sex offenders
ở
that
trong
we have
tập này.
screened. The challenge is only 40 of them
Mà không
have a
có
place to
tính
go.
nguy hiểm đối với cộng đồng.
And so the question is, do you make a bad situation worse by releasing someone that's not ready to be released because they don't have a place to stay? They don't have a place to go. They don't have plans in place. It's not an excuse, quite the contrary. It's an imperative that we work to keep our inmates safe and our staff safe in these correctional facilities. And I just want folks to know we are working overtime to do just that. I'm pleased and I'm very grateful. Members of the California legislature will be doing an oversight hearing, and we'll be talking a lot more in the next few days about the details and strategies and plans. But it's just an example of some of the work we have to do and some of the concerns we continue to have as it relates to the spread of this disease. Different settings, different criteria, different conditions, different challenges that present themselves on a daily and a weekly basis. So we are monitoring, not just monitoring that situation, we are actualizing plans to move people, and we are doing it as responsibly as we humanly possibly can. And I just want folks to know, advocates for urgency, to know your voices are being heard, for family members or loved ones in those facilities, to know your voices are being heard, and know that we are committed to meeting our responsibilities within CDCR, and moreover, as we release prisoners, the impact that will have outside of our system as well. So I just wanted to highlight that, update you a little bit on San Quentin. broader overview about the dimmer
Cải tù
switch,
ông đang
broader
nhắc
overview on
tới nhiều lần
some
là
of the
cải tù San
progress
Quentin
we
là một
have
cái cải
made in
tù
the state and some of the concerns that
tiếng ở
continue to persist
California.
throughout the state of California. I'll just end
Tức là cái vấn đề
as
mà giải quyết
I
vấn
tend
đề
to
lây nhiễm ở trong
on a
các
daily,
trại tù
weekly,
cũng là một cái vấn đề hết
monthly.
sức là nhiều cái mà
Seems
cần
like
phải làm việc.
most of 2020 with this
Phải giãn
following.
cách họ ra như thế nào,
Please wash your
sẽ trả
hands,
họ về
practice
trước
the hygiene
thời hạn
that
như thế
we know
nào và
can mitigate
trả về trước thời
the
hạn sẽ phải
spread of
dựa
this
trên cơ sở
disease.
nào,
Please
sẽ ảnh hưởng
physically
như thế
distance
nào đối với
when you
cộng đồng
can.
khi mà trả công
When
nhân ra sớm như
you
vậy.
are out and
Ai không
about
được
and
ra,
you're coming across
có những
people,
người mà không
lines, or
có
in
kế hoạch gì cho cái tương
out
lai
on the
của họ,
street,
không có nơi
just do
nào
your
để nương
best
tựa
to
thì phải làm sao, vân
keep
vân.
that safe distance. And where you
Không hề đơn
can't,
giản tí nào.
well, where you now must, please wear a face covering, a face mask. It is incumbent upon all of us
Có
to
bạn Lâm
take
Quỳnh nhắc
advantage
tới cái vấn đề
of
mà
this non-pharmaceutical intervention that can truly mitigate the spread of the disease, that can
ông
help keep
Newsom,
you safe,
thống đốc
that can
này là đã từng đặt
keep
một
other
cái
people
hợp
safe,
đồng
and
1
then,
tỷ
more
mua Trung
importantly,
Quốc thì cũng
also
đã
sends a
bị
message
nhiều người nhắc tới nhiều
that
mà
we're not
chưa
out
có
of
câu
this
trả lời
by any
rõ
stretch of
ràng
the
từ ông.
imagination. We still are in phase one, or rather first wave of this pandemic, and we have a lot more work to do. Final point, by the way, point of personal privilege, because it's important. We have been very successful in the state. Close to 250 million masks now are in our inventory. In fact, in excess of 250 million masks are now in the state inventory. Hundreds of millions we want to get out in the next weeks and months. We've sent out tens of millions of
Ông nhắc
masks,
tới là hiện nay
N95
California có
masks,
khoảng
not
chừng
just
250
procedure
triệu cái khẩu
masks
trang đang dự
and
trữ và
surgical
sẵn sàng để mà
masks. I just want folks to know
gọi là
we have been
cung cấp ra.
blessed with receiving this unprecedented inventory in the last few weeks, and so much so, I've mentioned this on a few occasions, we've sent 17 million of those masks to other state to help support their efforts as well. And so we announced on Friday that we're going to be distributing for free masks within sectors as we reopen our economy. Part of reopening the economy safely is having face coverings for workers.
Theo ông thì một trong những cách mà mở cửa, một trong những cách mà mở cửa theo ông mà an toàn là sẽ có phải có đeo khẩu trang, bắt buộc phải đeo khẩu trang, và hiện nay thì California đang có cái chương trình mà phát khẩu trang miễn phí cho những cái nơi mà cần thiết.
And working with our manufacturing industry, working retail, grocers, working with farm workers, and other representatives across the spectrum, we are distributing millions and millions of masks. In fact, 35 million masks were just sent into 3 sectors of our economy. We announced that on Friday. Tens of millions more will be forthcoming. With that, look forward to any forthcoming questions you may have.
Patrick Healy.
Rồi bây giờ ông nhận những câu hỏi.
Guy Marzorati, KQED.
Thanks, Governor. I'm wondering if the state is considering any changes to its policy around transferring inmates between prisons in the state, and also wondering if you agree with some of the calls from some North Bay local and state representatives for the federal courts to replace the federal receiver overseeing medical care.
Yeah, no, as I mentioned just a moment ago, we have already mitigated the transfers within the system going back a number of months. There was, unfortunately, there was a cohort of prisoners that were transferred from Chino Prison. It looks and it appears to be the case. Again, we're still getting through the complete investigation, so I want to have that as a caveat of consideration before people run with it, though it's been reported there was a transfer from Chino into San Quentin that unfortunately was tested but was transferred and nonetheless turned out to be positive. The receiver, and the question you're asking, just to explain it to others that may be watching, wondering what a receiver is and what you're even referring to. A number of years ago in the state of California, because the incapacity for this state to address the medical needs of its inmates, the federal government intervened. This goes back a number of administrations, many, many years ago, and basically took over the function of the healthcare delivery within our prison system. And the receiver, in this case, was instilled, who makes those determinations, makes those decisions. But to be fair, makes those decisions and determinations in partnership with many different players. So I'm not of the opinion that some are about the individual receiver at this stage. This is an incredibly daunting and challenging responsibility, and we're just uncovering in real time an understanding of what specifically happened regarding that transfer from Chino to San Quentin. But nonetheless, one thing lacks any ambiguity whatsoever, and that is over 1,000 prisoners have already tested positive in San Quentin prison. And we have formalized strategies and plans, including the prospect of using Seton Hospital, one of our alternative care facility sites, if we have to transfer many, many patients into the hospital system from San Quentin. So all those processes and protocols are being put into place, have been put into place, and are being worked on in real time. Again, we'll be making announcements probably on a daily basis, not just a weekly basis, as it relates to further efforts in this space.
Alexi Kosef, SF Chronicle.
Hi, Governor. The unemployment rate in California remains higher than nearly every other state in the country. And I'm wondering if you think this is a reflection of California's, slow efforts to work through the backlog of unemployment claims at EDD, or if there's other unique circumstances that that make the economic recovery here slower and more challenging.
Yeah, I don't think it's in relationship to the frame of your question. I think it's foundational. In the state of California, we tend to do better in the good times, tend to do a little bit worse in the bad times as it relates to the macro economy. California was experiencing 100-plus days ago record low unemployment, 121, I believe, consecutive months, 119 or 121 consecutive months of net job creation, bond rating, the highest it had been in 2 decades, and enjoying record reserves and enjoying, once again, a significant and sizable surplus, which we estimate at the time roughly $6 billion. The budget I'll be signing later this afternoon addresses a $54.3 billion shortfall and also deals with the reality, as you correctly state, 16.3% unemployment rate in the state of California. So we're doing everything in our power with our economic workforce, or rather economic recovery and workforce development task force with some of the best and the brightest minds in small business and more broadly social justice and industry with just depth of experience, their perspective, their leadership demonstrable in this 100 individual cohort of leaders to help guide us to an economic development, economic and workforce development and recovery plan. And so we are committed to that. We're resolved to that. We were very pleased. I'll be pleased to sign a budget today that helps, it waives the costs associated with incorporating as a new business startup for the next year, provides tens of millions of dollars of additional small grants and loans to, loans to small businesses, many that fall through the cracks, that don't get SBA support or the PPP support and the like. We have a lot of work to do, but I'm very confident in our resiliency, our capacity to recover as a state.
Governor, why just close bars? You mentioned they were areas of concern. Through contact tracing, are you finding that bars are areas where a lot of people are contracting the virus? And then in terms of Imperial County, I know their stay-at-home order is still in place. How do you want them to be more restrictive, and does that tie back to enforcement?
Yeah, I mean, at the end of the day, look.
Câu hỏi vừa rồi nói là tại sao ông lại đi đóng cửa các
we want to give them cover, making the right decision. If they don't, we will enforce the decision to pull back and have a stay-at-home order, and that's done on the basis of working very collaboratively, and as I said, including this weekend where 3 cabinet secretaries went down, including Dr. Angel herself, went down and visited with their health officer, their CAO, which is their city administrator, had really robust conversations, very positive conversations about how we can help support their efforts to mitigate spread. As you know, for weeks and weeks now, we've been providing other tenets of support, but we believe, working with their health officials, that pulling back to the stay-at-home order is advisable at this moment in order, again, to mitigate the spread of this disease, to help support some stabilization in their hospital system, as well as address their positivity rate, which I noted in the state over a 14-day period, it's 5.5%, 23% as of last week in Imperial County. So that's an example of collaboration, partnership, support, technical assistance, and resources. Look, as it relates to bars, what we did is we reached out to state health officials all up and down the state. They made a number of comments about what they're seeing in their communities as it relates to spread. We talked about community spread in some areas where that was most self-evident, most problematic. Other issues related to congregate facilities, I referenced prisons a moment ago. Others as it relates to still challenges they have in senior and adult daycare facilities. We also heard a lot of consternation and concern from health officials about family gatherings. I mentioned that a moment ago, and that's just people letting their guard down, bringing up Uncle Bob, Aunt Susie over, and all the cousins over. And while you start with all the best
Ông cũng đang
intention,
nói
and
tới
maybe
cái
people show
một
up
trong
with their
những cái
masks, they immediately put the mask down in order to have a drink, eat some
khả
food,
năng
and all of a
lây
sudden,
nhiễm nơi mà
cousins
lây
get a
nhiễm
little
nhiều nhất
closer, the
là
kids are
những
jumping
cái
on
buổi
top of
họp
you,
mặt gia đình.
and
Bây giờ đây thì mọi
Susie's
người
now
đã bớt
pulling you off,
là
and then
cảnh
makes a
giác, cho nên
mistake
là
to kiss you
gặp nhau
goodbye
ít
and
hơn.
says, I didn't mean to kiss you goodbye.
Trong gia
You
đình
know, all the normalcy of
cái
life, love,
khi
family,
gặp nhau thì bỏ khẩu
relationships,
trang ra
and you let your
ăn
guard
uống với
down. And
nhau.
we're seeing a
Đó là
lot
cái
of that. And that's a point of
một trong những
real
nguyên nhân rất
concern
nhiều.
from the health
Theo
officials,
như là ông nói,
specific to your question. And bars were referenced by a number of people. And no one's naive. Look at some of the images. My phone is filled with images of people taking photos of some of the bars over the weekend.
và ông
saying,
nói là những
how
cái
could
nơi
this
bar cũng
help
vậy,
with
là
community spread? It's
những
only
cái
going to make things
nơi mà
worse,
rất nhiều người
not
tới
better.
ăn uống,
You're in a bar, you're moving around, you're drinking, your mask's off, you're
rồi
close
đi
to
chật
other
chội trong
people.
đó gặp nhau lúc
We're
đó
seeing that
bỏ
in other
cái
countries. You
khẩu
saw, for
trang ra.
example, in South Korea, some infamous examples in South Korea as they were making real progress. They had to pull back on bars and nightclubs,
Ông
which they
cũng
were
nhắc tới
specifically
cái
able to track.
tình
So
trạng ở bên
our health
Nam Hàn
officials,
cũng
county
như
health
vậy,
officials
khi mà
identified all
ít
of these
người
areas
bị
as
thì
hot
người
spots.
ta
Again,
bớt
each county is different. Each county
khó khăn
seeing
các
something different.
nhà hàng
But
tiệm
in
rượu,
the aggregate,
quán bar
based upon that
ra.
feedback,
Thì bây
based
giờ
upon
Nam Hàn
evidence
phải
of spread,
cái số
based
lượng
upon
đông
the
quá
concerns, we went
bắt đầu đóng lại
forward
bớt.
with these 15 counties where we have mandated and or advised the closure of these bars.
Taryn Luna, LA Times.
Governor, the requirement on bar closures allows bars to remain open if they serve food, which we know many do. It also allows bars to contract with food trucks or other food vendors to remain open. So if someone wants to go out and drink in public, they still can as long as they order a plate of fries with their alcohol. So what practical effect does this have on preventing the spread of the virus?
Well, I'm going to have Dr. Galley answer that. I know a thing or two about this business, as you know well, and so you're describing exceptions, not the rule, and to the extent we expect compliance and we expect better behavior, and that we are committed to enforcing compliance, as I've been very clear moving forward, I think we can mitigate the stress and that concern. But Dr. Galley, who's very familiar with LA County in particular, and moreover, relationship to this guidance that he helped draft, can answer more specifically.
Câu hỏi liên quan tới một lần nữa là câu hỏi liên quan tới đóng cửa bar như thế nào đó, thì ông đưa lại cho bác sĩ nói chuyện.
We looked closely early on at restaurants that also serve alcohol and then bars as different. Bars being places where primarily you are there to drink alcohol. We are targeting this intervention around the bar closure at the second group, bars, where food is not the primary driver of the business. In those locations where you might have a restaurant with a bar where you can sit down and not just have a drink but order food, this does not apply in the same way. So we tried to clarify in that guidance.
Ông nói tới là những cái nơi mà bán rượu không, nó khác với lại bán vừa bán rượu vừa bán thức ăn. Nó sẽ có cách
and we will be in constant contact with our county partners to understand how this might impact what they're seeing and experiencing in their communities and how this plays out in their data. So just to clarify again, that bars where primarily alcohol is consumed, you may be able to order some food there, but that is not the primary purpose for gathering or being a patron at that location, versus restaurants where you're primarily there ordering food. You may do that at the, quote, restaurant bar, have a drink as well. Those are different in how we handled it in this guidance.
Dr. Galley's point in this guidance, let me be forthright with you. We are considering a number of other things to advance, and we will be making those public as conditions change, and we will make public at, we believe, the appropriate time based upon our feedback and engagement with local health officers. So what Dr. Galley was saying, this is a dynamic process, not a static one, and changing environment, changing conditions, changing data will present itself a new set of facts that will allow us to process those facts, make some determinations as it relates to augmenting the orders and advancing perhaps even more restrictive ones as may be necessary.
Kathleen Ronayne, AP.
Hi, Governor. Back to bars. So I understand the point that you're making that counties each have their own sort of unique circumstances, but it sounds like we made the decision to close bars not because we're tracing outbreaks there, but because they are public health officials consider them to be the highest risk spaces. So if we know they're high risk spaces, why aren't we closing them statewide? And then secondly, some advocates today called for relatives to be able to visit loved ones in nursing home facilities if they follow appropriate safety protocols. They say that people in these facilities are literally dying from isolation. So what needs to happen to allow the resumption of visits in nursing homes?
Yeah, no, a perfect opportunity. Dr. Galley's been working on that issue as well. Let me look, as it relates to factors across the state, I began this presentation, I'll end it, by making the point that there are different dynamics that play out differently in different parts of the state. And so based upon the data, based upon the dashboard we put out, based upon the criteria Dr. Galley referenced today, the criteria of 14 days on this watch list, 3 to 14 days where we have concern, we will process. 19 counties representing 72% of the state population, we are now advising related to the bar closures or mandating, as is the case in those 6 counties plus Imperial, the 7th. But certainly your point is operable, but only when the data bears out that we should advance it. With that, let me ask Dr. Galley to talk about skilled nursing facilities and the issue of spending time with loved ones, particularly near the end of life.
Ông để cho ông bác sĩ nói về cái tình trạng mà làm sao như thế nào có thể thăm những người thân ở trong các cái trại người già.
On Friday, we had an all facility letter go out through CDPH giving guidance on exactly how visitation in skilled nursing facilities can occur in a lower risk way. We recognize the need and frankly, the demand of loved ones to be able to not just visit, but participate in the care and nourishment of those family members in skilled nursing facilities. This has always been an asset to the facilities, the families, and the residents to continue on the road to better and improved health and happiness. And over the period of COVID, the last few months, we know it has been very hard to see that diminished and altogether forbidden while we try to contain spread. We do feel like we're at a point where it can be done in a safer way. So that is the purpose of having that facility guidance out. And I hope that over the days and weeks to come, that in a lower risk way, that we can begin to provide visitation to certain family members, to not just see loved ones, but to support the care that they need.
Next question.
Final question, Lucas Albert, Wall Street Journal.
Hi, Governor. It's a two-part question. One is for a county to kind of come on the radar of state health officials for a higher level of positivity percentage. What is that percentage that sort of is crossing the threshold? And the second part is specifically related to LA County. The decision to open bars, which I believe was on June 19th, the week prior to that, the positivity rate was 12%. And similarly, when you opened restaurants there, positivity rate was 13%. Was that too high? Did things move too quickly in that county, perhaps?
Yeah, so this is an opportunity to go back to the slide regarding local conditions driving our response and what the criteria in terms of elevated disease transmission, hospitalizations, limited hospital capacity. Dr. Galley can walk back through this slide and ways of directly answering your question. Doctor?
Again, thank you, Governor, and thank you for the question. I'll just remind you that we have, from the beginning of the county monitoring process, coupled with the attestation process for counties to declare that they have both the level of epidemiologic data that is in good shape, plus the preparedness information around PPE, hospital capacity, testing, contact tracing, that together counties were in a position to decide when to move forward. The state had given clear guidance on the how. In the case of any county that gets onto the county monitoring list, I want to say that being on the county monitoring list also brings with it additional attention and focus, additional assistance, some additional resources and services at the state level, and really galvanizes the response at the county level in order to try to stay in front of and make sure that spread does not increase so rapidly. In the case of Los Angeles County, they were one of the later counties to be able to attest, in part because of their initial level of transmission, as well as the need to take some time to create that preparedness that we know is essential. Since that time, obviously across the state, we have seen an increasing number of cases, and we expect that at those local conversations between health officers, health departments, local leaders, they're making the decision to move forward with certain sectors. Our decision this weekend to look closely at those counties that have been on the county monitoring list for at least 14 days, requiring that they close the bars, is a move to be focused on those areas where we know spread or transmission has not only increased but sustained, and looking at high-risk areas where mixing is frequent, contact tracing is difficult, such as bars, as places to not just take a pause, but to move backwards so we can stay in front as much as possible of transmission of COVID-19, not just in those counties and across the states. We have learned with Imperial County that not only is the hospital system in the county important, but the regional and statewide system to support increases is equally important. So that look at county by county has implications statewide, and we will continue to look at it not just at the county level, not just at the regional level, but statewide in order to make and support good decisions at the local level and the state level.
And it's just an important point Dr. Galley is making, and you heard this almost become a mantra. When we put out guidelines, it does not mean go. When we put out sectoral guidelines, it's a document that says how we believe you can responsibly and safely reopen. It absolutely does not attach to when. There is some sense, and perhaps a little ambiguity in terms of some of the reporting that I've read out there, that the state makes that determination. You just heard Dr. Galley express to the contrary. Local county health officers with their county elected officials make that determination as to when they are prepared to safely reopen. We provide the technical assistance through this attestation process of what we expect in terms of the criteria. We post that criteria, and then we monitor progress towards the stated goals. As Dr. Galley said, and I got to give them a lot of credit, that local health officials, county and LA's own mayor, Garcetti, were very, very focused. As a consequence, did not move as quickly as other counties to the attestation process or as quickly through the phases as other parts of the state. I just want to acknowledge that because I have great respect for local decision-making on the front end and recognize the deep responsibility we all have to monitor and not be complacent at the same time, to provide supports as we continue to do to those that need those supports. So with that, I Just want to thank all of you for supporting the cause of giving us this chance to update you on where we are related to this pandemic. I will remind everyone the imperative and importance of individual decision making, and the sum total of those decisions will determine the fate and future of the spread of this disease. Please practice physical distancing. Please, when you are in cohorts mixing with strangers, people that are not part of your household, please wear a face covering. It's a mandate in the state of California. No sign of weakness, only sign of strength, wearing a face covering. And also know, from that perspective, we want to strengthen our resolve, and that's why we have applied this dimmer switch to certain sectors within our economy, and certainly will hold out that if we do not see a mitigation of the spread, that we'll consider to doing more. With that, I also want folks to know we have a lot more work to do on contact tracing, in addition to providing the kind of supports to these cities and
nói còn rất nhiều việc phải làm, nhất là liên quan tới cái vấn đề truy tìm. Thực ra thì tất cả những cái luật hoặc là sắc lệnh ban ra bây giờ đây nó mang tính chất nhắc nhở, báo động cho mọi người hơn là cái tính chất ép buộc. Tại vì bây giờ cái tình trạng là muốn ép buộc mọi người làm thì cũng khá là không khả thi. Ví dụ như cái vấn đề mà bảo là nhà thì cũng là bây giờ nhắc nhở rồi báo động để người ta tự giác thôi, chứ còn không có cái lực lượng nào đủ để mà có thể áp dụng cái chuyện mà ở người tại cách ly tại nhà. Ông nhắc lại là đeo khẩu trang.